All right, we're going to be doing our torso, focusing on digestive structures. We're going to start here with our teeth. We have our central incisor, lateral incisor, canine, premolar 1, premolar 2, molar 1, molar 2, molar 3, which is the wisdom tooth. We have our upper left quadrant and our lower left quadrant. The next thing we can see is our esophagus, which will come through down to the cardia of the stomach. So we'll get more to that in just a minute. So for right now, we'll start here with our liver. We have our left lobe, our right lobe, our falciform ligament, and we can see the tip of the gallbladder. When we reflect the gallbladder up, we're able to see our caudate lobe next to the inferior vena cava and our quadrate lobe next to the round ligament. These structures here are the structures of the porta hepatis, including our common hepatic duct, hepatic portal vein, and proper hepatic artery. Here we are able to see our right triangular ligament and our left triangular ligament, and the space between there is the bare area. Now we have our stomach, and you can see that our cardiac sphincter is here. So the regions of the stomach include the cardia, the fundus, the body, and the pylorus. We have our lesser curvature and our greater curvature of the stomach, which is the attachment point for the greater omentum. If we open the stomach, we're able to see the specialized feature of the mucosa, which is the folds of the rugae that include both the mucosa and the submucosa. The muscularis externa of the stomach has a third deep layer called the oblique layer, and then you also have the circular layer that makes the sphincters and the longitudinal layer that aids in propulsion. If we come out here, we can see, again, our muscularis externa here, and our serosal layer is here. And so they're kind of showing you that serosa. Now, here is the boundary between the upper digestive tract and the lower digestive tract. This is the junction between the pyloric sphincter of the stomach and the duodenum of the small intestine. As we know, the duodenum and the pancreas are secondary retroperitoneal structures. And if we come around, you can see the curving of the pancreas the curving of the duodenum with the head of the pancreas in the middle. Here we have the plicae circularis with the major duodenal papilla, which is going to allow bile from the bile duct to enter, as well as all of the zymogens, right? All of the pancreatic enzymes through the main pancreatic duct, and here's your accessory pancreatic duct and your common bile duct. Then you're going to see that we're going to pop through to our jejunum on top and our ileum at the bottom with our ileocecal valve. Here is the cecum with the appendix, and the connective tissue here is called the mesoappendix. And back here we're looking at our sigmoid mesentery for the most part. Then we have our ascending colon, which is held in these little bunches or pouches called haustra by these 3 strands of longitudinal muscle called the tinea coli. So we have our ascending colon and then our hepatic flexure, and then you have your transverse colon with your splenic flexure. So you can see that the tinea coli is not continuous. It's in the front here, and then it pops up in the back. So here you have your descending colon and your sigmoid colon, and way back down here you have your rectum. So let's go ahead and pull out this female reproductive tract and our rectum. So here you can see the rectum coming down with our anal canals and anal columns. We have our internal anal sphincter, which is smooth muscle, and our external anal sphincter, which is skeletal muscle. Done.